NHS Improvement has issued a patient safety alert on the risk of harm from inappropriate placement of pulse oximeter probes. Pulse oximeters measure the amount of oxygen in a patient's blood, using a probe or sensor attached to the patient. They are in common use in general practice, hospitals, ambulances and care homes. Most pulse oximeters are designed to take readings from the finger. However, sometimes this can be difficult. For example, when a patient's hands are cold or bandaged, if they have tremors, if they are wearing certain types of nail varnish or false nails, or have henna patterns on their fingers. In an attempt to overcome this, some staff have instead attached the finger probe to the patient's ear. This must never happen. Attaching a finger probe to the ear is likely to give an inaccurate reading. This can lead to missed opportunities for early diagnosis and urgent treatment. In some situations, it can also result in a patient receiving treatment they don't need. When a reading cannot be taken from a finger, it is essential that an alternative oximeter probe is used, one specifically designed for use on a different part of the body, such as the ear. As staff have not always had access to ear oximeter probes, our alert asks providers to ensure they are made available and that staff know where to find them. Once packaging is removed from a pulse oximeter, there is often no easy visible reminder of which part of the body the probe is intended for. We are working with manufacturers to change this. In the meantime, we have asked providers to display posters or labels showing which part of the body a probe is intended for. Children and babies also need the right probe for their body weight for readings to be accurate. To support you to always use the correct probe, your organisations should provide access to all types of oximeter probe or sensor that your patients need, and posters or labels that remind you of this. If this has not happened in your organisation, ask your manager why not. Remember, never attach a finger probe to a patient's ear. You will not get an accurate reading, and this could harm patients.